Hello, good noon. I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Zafar. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm really sorry to hear about that, Mr. Zafar, and I understand your worries. How a stressful situation would be for you. Mr. Zafar, can I check your report? Mm-hmm. Mr. Zafar, 30 years old, quantity 2 ml, liquefying time 30 minutes, consistency turbid, sperm count 15 million, and motility activity is 10%. Okay, all right, Mr. Zafar. Keeping a report in mind, I'd like to ask you a few questions, okay, to better understand your condition and questions about your private life, okay, as well. But before that, let me reassure you that the whole conversation will remain confidential between you and me, okay, and nobody else will ever know about it, if it makes sense to you, Mr. Zafar. Mm-hmm. Thank you for trusting me, Mr. Zafar. So first of all, let me assure you that nowadays there are certain new technologies, okay, and methods available for the help of which even people with low sperm count can also produce child, okay. Mr. Zafar, have you got your wife checked by some gynecologist? Mm-hmm. All right. Mm-hmm. So, Mr. Zafar, how about your mood? Mm-hmm. Okay. Mm-hmm. All right, Mr. Zafar. So, how frequently do you go to your wife? Mm-hmm. And do you know the properties of her menstrual cycle, in which you should meet? Mm-hmm. Is your wife cooperative? Mm-hmm. All right, Mr. Zafar, if it was forceful marriage, or it was of your choice? Mm-hmm. Okay, all right, Mr. Zafar, do you have morning erections? Mm-hmm. And do you have any problem achieving and maintaining sufficient erection required for intercourse? Mm-hmm. All right, Mr. Zafar, did you have any swelling over your face in childhood? Mm-hmm. Okay. If it was, what doctors told that what it was? Mumps? Okay. All right, Mr. Zafar, did you have any contact with any TB patient? Mm-hmm. Have you noticed any discharge from a front passage? Any change in your beard or hair loss? All right, Mr. Zafar, do you have extramarital affairs? Mm-hmm. If it is your first or second marriage? All right, and Mr. Zafar, what do you do for a living? Mm-hmm. Okay, so at restaurant, or what you have to do? You have to cook, or you have to serve? You're a chef. Okay. Mm-hmm. And how you used to go to your restaurant? Uh-huh. Okay. Are you into some sports as well? All right, Mr. Zafar. And do you have high blood pressure? High blood sugar? Any stomach-related problem? Mm-hmm. If you're taking any medication for that? Uh-huh. All right, Mr. Zafar. And do you smoke? How many cigarettes per day? Have you ever tried to quit this habit? I really appreciate that, Mr. Zafar, and we'll talk in detail in next appointment. Is it okay with you? Mm-hmm. Okay, and do you drink alcohol, Mr. Zafar? Uh-huh. If you are taking any medication prescribed by doctor or over the counter. Okay. Mr. Zafar, do you have any family history of such problem? Any history of infertility? Okay. All right, Mr. Zafar. So how this problem has affected your life? I'm very sorry to hear about that, Mr. Zafar. I understand your concerns. Okay. So, Mr. Zafar, what worries you the most? Okay. All right, Mr. Zafar, you need not to be worried. I'll try best of my abilities to solve your problem. Okay, is it okay with you? All right, Mr. Zafar. I cannot commit any, thing definitely. Okay, on single report. Okay, semen report, but I'll offer you another semen report after about 5 to 7 days of abstinence. Okay, and sample should reach a lab within 2 hours. Okay, and I'll encourage you to keep it warm in your pocket on the way. Okay. Yes, and besides that, I'm also offering you some hormone tests like semen testosterone, okay, LH and FSH, okay. And yeah, I forget to ask you if there is any breast tenderness or discharge from the nipples, right? Okay. Otherwise, I would have order another test, but it's okay. So, Mr. Zafar, please see me as soon as the report of investigation has come. Okay, I may need to refer you to one of my senior colleague, okay, a specialist. Okay, but we'll decide later after investigations. Okay. So, Mr. Zafar, what I have gathered from your history, okay, and question I've asked, okay. So I think there's most probably yours is a case of oligospermia, okay, and it is low sperm count, okay. But we need further investigation, and there are new methods by the help of which even people with low sperm count can produce child, okay. And besides that, Mr. Zafar, as in your case, most probable cause is mumps, and you had in your childhood, okay. Besides that, you are also a chef at restaurant, and you used to go to restaurant by using a bicycle. Okay, so these all could be the reasons. Okay, and also you are smoking. Okay, so I'll encourage you to stop smoking completely. Okay, and as you are taking tablets cimetidine, okay, for burning stomach, so I'll prescribe you alternative method to deal with your stomach burning, okay. And besides that, I'll encourage you to quit smoking, okay, and do some yoga and meditation, okay, and try to reduce stress level from your life, okay, and eat a healthy diet, okay, maintain normal weight, okay, and I'll encourage you to walk for 30 minutes, okay. Is everything clear till now, Mr. Zafar? Yes, Mr. Zafar, as a doctor and your family physician, I cannot tell a lie to your parents, but it will be it will be unethical on my part. Okay, I may lose my medical practicing license. Okay, but however, we will find solution to your problem as we discussed. Okay, and we can find solution to your problem in other way as well, like in vitro fertilization and test to baby adoption. Okay, and there are so many methods. Okay, is everything clear till now? All right, Mr. Zafar. So Here is the leaflet. It includes all the information regarding your condition. Okay, I hope it will be helpful for you. Okay, and see me when reports are ready. Okay, and here is my contact number. You can contact me anytime. Okay, and I thank you for your cooperation and for trusting me with your private life affairs. Is everything clear till now? Okay, Mr. Muzaffar, I wish you a healthy life. Take good care of yourself. Bye-bye.